Hello and welcome. We're back looking at more policies. We're going to take a look at United Healthcare this time. And it was noted that we should disclaim that the reviewing of this policy does not guarantee that your patients will be covered and that this will guarantee you payment for billing them, I guess. Is that what we want to talk about? Okay.
Yeah.
All right. We're going to review the policy. We're going to have a bunch of links in the description. This is the stuff that we look for when we're going to see if our patients are covered for our services, for Felicia services as a dietitian.
So the first thing, we're on United Healthcare's main website at this point. And honestly, the easiest way to find their policy for nutrition is actually to search where it says like, what can we help you find? Preventative care. Because sometimes it's pretty easy to find medical policies and sometimes not so much. But United Healthcare, we're just going to type in the top preventative care so we could find their policies for medical nutrition therapy. All right, so preventative care services. So we want to look at this first one, the commercial and individual exchange medical policy. All right, so for this one, you could see the effective date is April 1st, 2023. Why that's important to note is these medical policies are often going to get updated. So you just want to make sure that you're looking at the most up-to-date one. Now, when you are looking at policies and keeping up to date with medical policies, this is where subscribing to like the provider newsletters is going to be really helpful so you can have the most up-to-date policies. So for this one, we're going to search 97802 because it's 45 pages, so there's a lot on here.
Control F, 97802, it snaps me right here.
So this first one, it says screening for prediabetes and type 2 diabetes. And we could see the MNT codes 97802, which is the initial, 03, which is the follow-up, 04, which is the group session. So that's 2 or more individuals. And what you could see here under diagnosis codes is it says R73.03, prediabetes. So there is coverage for prediabetes with United Healthcare, specifically with a prediabetes code. The other thing on the right-hand side that you want to take note of, it says prediabetes preventive interventions, and there's a limitation on the ages. So 35 to 70 years old. So that's also something else to keep in mind as well as the age of your patient. So we're going to go to the next search result for 97802, and this brings us to healthy diet and physical activity for cardiovascular disease prevention in adults with cardiovascular risk factors, so that's important to note. So you can see again the same MNT codes, the individual follow-up plus the group are covered, and then you could see that there's a list of different diagnosis codes on here. So probably the ones that make the most sense for you to want to look at as a dietitian would be overweight codes, which are one of the E codes, plus BMI codes. So you could see Z6825, which is BMI between 25 and 25.9. We've got the body mass index codes as well, BMI over 40. Now anything that's like metabolic syndrome, impaired fasting glucose, hyperlipidemia, or like the E codes for obesity, like E66.01. Again, just as a reminder, you're going to need to have a referral from a physician or medical records with that specific diagnosis code on it. All right, so the next one's here. This is just looking at healthy diet, physical activity for cardiovascular disease prevention in adults. And again, we're seeing the same MNT codes here as well. Plus, we could see again BMI codes listed, hyperlipidemia codes, and then also obesity codes as well. So there's a clear idea of which codes are going to be covered for United Healthcare. All right, next one here is weight loss to prevent obesity-related morbidity and mortality in adults. So you could see the, again, same MNT codes as well. Plus, there are the diagnosis codes for BMI between 30 and 39.9, BMI over 40, and then also for obesity as well. All right, next one here, we have healthy weight and weight gain during pregnancy. If you work with individuals who are pregnant, there's also specific pregnancy diagnosis codes. So for this, we've got the MNT CPT codes, but there's a link under diagnosis codes and it has specific pregnancy diagnosis codes that would be covered for a patient. All right, so this link here, this was from right under where it said pregnancy diagnosis codes. And this list, you can see it says list contains diagnosis codes for the following: atherosclerosis, diabetes, and pregnancy. So all 3 of these, they're listed in order of category. So we have atherosclerosis. This is 80 pages long. So I would use Control F if you have a specific diagnosis code from a physician just to narrow down, but all codes relating to atherosclerosis, if you keep scrolling, there's going to be codes related to diabetes. And then if you keep scrolling, there's going to be codes related to pregnancy. And again, these are the ones that are specifically covered under their preventive care policy, but this would be something that you would want to make sure you take a look at.
When we bill United, usually we use a BMI code.
BMI code.
They're the easy ones to get paid for since they're covered.
Yep.
If you have any BMI between 25 and the upper limit, you can bill it.
Yes. If they have a BMI of 25 that was also with a cardiovascular risk factor, and then otherwise the BMI over like 30, or if it's like a specific obesity diagnosis, like one of the E codes,
E66.
you can use on their own. Yep.
So any BMI over 30 is billable.
Yep.
Z713 is not billable by itself.
No, Z713 is not billable at all with United Healthcare. It's not on their policy anymore. So one thing you've probably noticed with these policies for United Healthcare is they specify BMI codes, they specify ICD-10 codes and the CPT codes, but not how many visits are covered. So that's where you're going to actually need to call and verify coverage for patients. We've had some patients with United Healthcare. We don't really get a ton of patients with United Healthcare, but I've had some where they were limited to 3 visits, and others where it was 6 visits. So it really depends on the policy, but that's where you're going to have to call and verify coverage. So the next thing we're going to look at is United Healthcare's Medicare Advantage coverage summaries. So the first thing, it says Medicare Advantage coverage summary update bulletins. So we just want to look at that drop down first. And we could see here Medicare Advantage, the update bulletin. This has all information about anything that's been revised. And again, if you're on the update list as a provider, you're going to get emails that say specifically what each of the updates are going to look like and if it relates to anything with dietetics. All right, so the policy that we're looking at right now is preventative health services and procedures, but this one is specific to Medicare Advantage. You'll see on the top right and the top left, it says Medicare Advantage. This document in particular, we're going to scroll to page 8. And that's going to give us information about diabetes and renal disease. So there's a very tiny block here that says medical nutrition therapy for members with diabetes or renal disease. And then you'll see that there's 2 links. So we want to look at the summary for diabetes management equipment and supplies. All right, so for this one, you're going to see here it says medical nutrition therapy is covered for diabetic members when criteria are met. Registered dietitian or nutritional professional must render MNT. And then there's a link to the NCD for medical nutrition therapy. So again, you're kind of getting sent off to another website here. Now, this is specific to Medicare and Medicaid services, and this is basically United Healthcare follows Medicare guidelines. So their Medicare Advantage policy follows what Medicare's policy is for medical nutrition therapy. So if you scroll down under description information, you're going to see here it says the first year of coverage for a beneficiary or the patient, they get 3 hours of MNT, and then they can get 2 hours every year after that. And again, if they do need additional coverage, they can with a new referral within that same calendar year. And then there's also, again, limitations as to only having diabetes or renal disease.
This is very similar to Independence, where we just covered.
Yes, and we just went over Medicare in a podcast.
We did a whole podcast on Medicare. You know, a lot of companies just follow Medicare guidelines. So if you know Medicare, you generally speaking know Medicare Advantage. But it's important to check the P's and Q's on all their policies too.
Yeah, especially Medicare Advantage, you know, a lot of the selling point for Medicare Advantage policies is that they cover extra things that Medicare does not. That's not necessarily the case with MNT. A lot of them just straight up follow Medicare guidelines. So outside of medical policies that you want to look at for coverage for patients, the other important thing would be telehealth if you are a telehealth provider. So this is the telehealth page for United Healthcare, and you can see it says reimbursement policy, resources, and then the COVID-19 updates. We want to look at the reimbursement policy. So we're going to click on the learn more here. Now under here, you're going to see commercial, Medicare Advantage, and community plan. So the Medicare Advantage, again, United Healthcare is following Medicare guidelines. So Medicare at this point is still covering telehealth. So United Healthcare is covering it for the Medicare Advantage members. We're going to look at the commercial just to see what that looks like for United Healthcare. Now, there's a small piece here that has some information about telehealth and coverage. But what you want to look at is the full reimbursement policy, which is linked here down at the bottom. So that's what we want to open and take a look at. All right, so the first thing that we want to look at is we're going to stay on page 1, but where it says reimbursement guidelines, you can see it says that they're going to reimburse for place of service O2 or 10. So both of these are accepted code for United Healthcare. And O2, as a reminder, is if a patient is not in their home. So like if they're at work. Place of service 10 is if a patient is in their home receiving telehealth services. We're going to look at page 2. So we're going to scroll down. There's a section on modifiers. So it says modifiers 95, GT, GQ, and G0 are not required to identify telehealth services, but are accepted as informational. So we use modifier 95 in particular. Now, for a lot of other insurance companies, that's required to indicate that it is a synchronous audio and video session. But United Healthcare is saying they're just informational.
You should probably use it anyway, just as a habit. We've had a lot of claims get denied because modifier 95 was not included when this all first switched over and telehealth was kind of reverting back out of COVID mode.
Yeah, so, and you always want to be billing to what the exact service that you are rendering. So even if it's, again, informational, not required, then that way all your bases are covered. And you could see there's a description as to place of service 02 and 10 on this page as well. So the next thing we're going to look at is page 3. So there's a lot of important information with this policy. And the most important thing, actually we're going to scroll up just a little bit, is it says eligible care providers, and it's saying as described by CMS. So these are the types of providers that can deliver telehealth services. So if we look at the bullet list, we could see registered dietitian or nutrition professional would be listed. So dietitians, we can provide telehealth. And the last thing that we're going to look at is page 5. Now page 5, what it says here is telehealth eligible service codes. There's also a bunch of other links. So the first one we want to look at is telehealth eligible service codes. All right, so this is where you would search 97802 and 97803, and these are both on here along with 97804. So these are the ones that are eligible for telehealth under United Healthcare's policy. And then the other one that you want to look at here, and this is very specific to United Healthcare, telehealth audio only eligible service codes. So it says on here audio only, meaning if you were just doing like a phone session with a patient. So if you click on that one, you're going to also see that 97802, 3, and 4. This is a lot shorter of a list. All three of those codes are listed on here. So United Healthcare is still covering audio only. That's not the case for all insurance companies. So that's pretty much the gist of United Healthcare and their policies. So main things, again, you want to look at their commercial, their Medicare Advantage, and then also their telehealth. And that's kind of the three main things you're going to look at for really every insurance company. And again, the thing with United Healthcare policies, at least what's on their website, is it's not specific as to how many sessions a patient's going to get. So that's where you're going to have to call and verify benefits.
That's United Healthcare in a nutshell, their policies at least. Thanks for watching. If you have any questions, feel free to leave a comment down below. Check out our recent podcast where we did a deep dive into all things Medicare if you're interested in more things having to do with MNT and specific policies as it pertains to billing. But that'll do it for us. Thanks for watching.